Hi, I'm Dr. Russell Raath. I would like to address or ask a question. Is it necessary to wear sun protection factor or SPF at night? Sounds ridiculous. After all, it is sun protection, and maybe we should leave off the sun button, just use protection factors. But do we really need it at night? Let's explore this question. You see, we all know that there's electromagnetic radiation. We use it every day for our cell phones, radios, TVs. These are waves that are in the atmosphere, electromagnetic waves. And they go different wavelengths, longer or shorter, and then of course frequency. That's how many waves per second. Now, of all these waves, some of them, a very limited range, we can see. Our eyes can respond to them. And you can see we have non-visible wavelengths and visible wavelengths. On either side of the visible wavelengths, we have non-visible wavelengths. I'd like to just explore quickly the visible wavelengths that we can see. Remember, this is just a very small portion of the electromagnetic spectrum, but we can see them. So I'm going to take this red bar here and enlarge it and say this is our visible light, our visible spectrum of the electromagnetic spectrum that we can see. And it is made up of various wavelengths and frequencies that our eyes can respond to. And we know it's the colors of the rainbow. And this starts with red, orange, yellow, green, blue, indigo, and violet. If you look at a rainbow, these are the colors that we can see. All these colors together make white light. No colors at all make black or blackness, darkness. There is no light. So our visible white light that we see is made up of all these colors together. But there are some important wavelengths here. Below violet, we have ultraviolet. Everybody knows about ultraviolet, A and B, and the effect that it has on the skin. And on the other end, where we've got red, we've got infrared, which is something that burns our skin. And of course, we can't see that. It's part of the non-visible light. However, with special glasses, we know night vision glasses, we can see infrared, and we can see things moving around at night in the dark. But with our naked eye, we can't see it. And of course, the rest of the spectrum is also non-visible. However, the ultraviolet, and some of them going down below that, is regarded as harmful light, and above the infrared is also harmful. However, what I'd like to talk about here is blue light. Part of the visible spectrum that we can see, part of our white light, is blue light. Now, in a review article, what is a review article in a journal? Is when the authors of that journal, that article, review all or a whole lot of other articles on the subject and sort of summarize it. So you can go through all the different articles you want to, or in the medical journals, or just look at a review article which has summarized a whole lot of articles. And this review article appeared in the journal, or the International Journal of Cosmetic Dermatology. And the title of this article is, as you can see, Blue Light Protection. Part 1. There is a part 2. We won't go into that today, but the effects of blue light on the skin. Now, blue light, remember, is part of our white light that we see. Does it have an effect on the skin? And you can see this is quite a new article. It was only published in 2020, so it's new information. And they found that low energy and low exposure times to high energy blue light Now let's stop right there before we go any further. Low energy blue light or high energy blue light for a short period are safe. But here we're talking about high energy blue light. What do we mean by that? Well, if you look at the spectrum, our color spectrum again, starting with red on the right, red, orange, yellow, green, blue, indigo, violet, we'll see the amount of energy each wavelength emits. And if we look on the left-hand side at the blue light, we'll see there's some blue light that has a low energy, and there's some blue light and some indigo light that has very high energy. So some of the blue light is low energy, some of the blue light is high energy. And if you're exposed to the low energy blue light, it's safe for the skin. But if you're exposed to high energy blue light, it can be, for a longer period, it can be damaging and aging to the skin. We'll look at that now. So, there we have the lower energy blue light. Right, so what does it say here? Low energy blue light, which we now know what that is, or low exposure, short exposure to high energy blue light can help prevent skin disease. So if you're going to be exposed to high energy blue light, you must keep it to a short period, to low exposure to high energy blue light. But high energy blue light is part of the white light that we see. A lot of our interior lighting, if you look on the box or on the globe, it says daylight or cool white. White light contains high energy and low energy blue light. So low energy and low exposure to high energy can prevent skin disease. While studies have revealed that longer exposure to high energy blue light can increase the amount of DNA damage, cell and tissue death and injury, eye damage, skin barrier damage, and photoaging. So it's been shown in a review article, which summarized a lot of the other articles, that blue light causes skin damage, especially the high energy part of the blue light. And if you're exposed to that for a long period, and most of us are exposed to it the whole day, and even into the evening, but we'll come to that. So, longer exposure to high energy blue light. And this is especially a problem in South Africa. Why? That sounds crazy. Why is sun? Well, you see, blue light or high energy visible light is proven to be damaging, and especially in dark skin. Here's the thing, that if a person with dark skin or indigenous skin is exposed to white light for extended periods of time, and they leave the white light, let's say they're outside in the sun, and they go indoors or they go into the shade, the damage continues, or the damaging effect of the blue light continues for 4 hours after they have come out of the sun. So where do we get blue light? High energy blue light? Well, we get it from sunlight. Sunlight, we know from the rainbow, has got red, orange, yellow, blue, green, indigo, violet, blue. High energy blue light. But especially in the southern hemisphere. Now, whoa, does that mean the sun is different in the southern hemisphere to the sun in the northern hemisphere? Now, most of the studies in the journals are done in the northern hemisphere because that's where the research is done, the university that do research. And so their results may differ to what we experience down here in the southern hemisphere in South Africa. So what I'm saying is the sun is different in the northern hemisphere to the southern hemisphere. So can we apply the findings of the studies in the Northern Hemisphere to us in South Africa? Not really, eh? The sun in the Northern Hemisphere is different to the sun in the Southern Hemisphere and South Africa. What do I mean by that? Well, there's a thing called the tropics. We have, and they are called the Tropic of Cancer in the Northern Hemisphere and the Tropic of Capricorn in the Southern Hemisphere. Now, what is a tropic? Well, the tropics. The tropics is the lowest line, or the furthest line from the equator, where the sun can at any time in the year shine directly above you. So it looks like this. Here we have the equator, and in the Northern Hemisphere we have the Tropic of Cancer. And in the Southern Hemisphere we have the Tropic of Capricorn. Now, between those two lines is called the tropics, but that means between those two lines, at some time in the year, the sun can, at midday, shine directly above your head. Once you get out of those lines, the sun will never, even in the middle of summer, in the middle of the day, will it shine above you, directly above you. Now, that's important. Because look here now, where the Tropic of Cancer, in other words, most of North America, Canada, even Mexico, the sun never shines directly above the people. The whole of Europe, North Africa, the sun never shines at any time of the year in the middle of the day directly above. However, if you look at the Tropic of Capricorn, it cuts here through Limpopo in South Africa. So up there in the far north of Limpopo, the sun can, at some time in the year, in midday, shine directly above. Now, we are close enough in the rest of South Africa, we are very close to the Tropic of Capricorn. So while the sun doesn't ever shine directly from above, it's pretty close to directly above. Whereas the people in North America, it's never close to directly above. So the sun is different. So what's the importance of the sun shining directly above? Well, if you look at this sketch here, we have the big sun and the earth, and we have the rays coming to the earth, to all effects, to all intents and purposes parallel. You'll see that the sun shining directly above, overhead, are the shortest rays from the sun. The sun that's a little bit away from that and not shining directly ahead sort of hits the earth at an angle and almost bounces off a bit. And it's never as strong as the sun, as the rays shining directly down on you. So in South Africa, part of South Africa in Limpopo is in the tropics, and the rest of South Africa is very close to the tropics, and we have a problem of the sun shining directly from above, which means we get the shortest, most intense rays of the sun. Much more so than the people get in anywhere, even in Mexico and North Africa. They don't get the sun as directly from above. So, we get sunlight, we get direct rays in South Africa of blue light shining very closely to directly from above, especially in the summer. But here's more important. To get sunlight, you have to go outside. But artificial light, indoor lighting, fluorescent lighting, LEDs, that give you white light, in other words, electric light, has blue light in it. And most importantly, screens, TVs, laptops, iPads, cell phones, all those screens are notorious for emitting high energy blue light. So in order to prevent the damage from blue light to your skin, you need a sun protection factor that contains a blue light blocker. And you need it at night because of artificial light, which is aging us. Electricity is not the blessing it's made to be, because electricity brought us artificial light, which brings us aging of skin even at night. So we need an SPF with a blue light blocker even at night to prevent aging. So sunlight, going outside, your SPF needs a ultraviolet A and B blocker, as well as an infrared blocker, but it also needs a blue light filter or a blue light blocker, not just ultraviolet and infrared. As you can see, this is new information. This study that I quoted in the beginning was from 2020, 2 years ago. It's not common knowledge yet, and there's not many SPFs with a blue light blocker. And at night, due to artificial lights, screens, TV, cellular, all those things, you need a blue light blocker, even when there's no sun, because we are bathing ourselves, our bodies, our faces and our hands, especially, in blue light. And blue light is aging us as much as ultraviolet or infrared. So we need, even when there's no sun, if we're working on screens, if we're working with white light, we need a blue light blocker. Interestingly, firelight and candlelight do not have blue light in them. Why? Because they've only got the red, orange, yellow part of the spectrum. They don't have blue light. But of course, we don't work by candlelight anymore. We work by artificial light at night, which contains blue light. At this point, I'd like to thank the sponsors of this video, and that is Nakaro Premium Skincare Products. They have kindly sponsored the making of this video to get the message out there about the dangers and problems associated with blue light. Nakaro Skincare do make a range of skin products, but most importantly, I would like to show that they do make an SPF. And that SPF, although it hasn't come out very well on the screen, but you can see the SPF face, and on the tube it says there, extended protection for UVA, ultraviolet A, ultraviolet B, and high energy blue visible light, and infrared A. So here is a SPF that contains a blue light filter, which could be used at night when you're getting a lot of screen time. Well, we're getting screen time in the day too. So we should have this on all the time in the modern age, and especially in South Africa, because we've got the direct sunlight, more intense sunlight than they have in the northern hemisphere. And you can put the SPF on under your makeup, and it will protect you from the harm of blue light. So I'd like to thank Nakaro for sponsoring the making of this video, and I ask you to please support them. They support the making of lots of videos, and we'll see more videos made by me, sponsored by Nakaro, and I'd like to thank them and encourage you to please support our sponsors for their effort in making the video possible. And you can contact them on their website, where you can get more information on all their products and all their, especially on the SPF, and how to use the products, as well as information on the ingredients in the products, They really are premium products. And you can contact them on www.nocoroskin.com. Thanks for watching. Till next time.